Okay, Chairman, we are ready to go.
Thank you, Dr. Townsend-Smith. We are now back in session, and we're going to make a slight change to our schedule to accommodate the outside speakers that have graciously agreed to spend some time with us this afternoon. So we will move to the COVID-19 update item, and then following that, return for the SLA committee. As we prepare to open schools for students, educators, and all staff this fall, we will continue to provide relevant updates to respond to the questions and concerns that we hear from students, parents, and educators. As stated last week, while we may be frustrated or disappointed in the delayed announcement of the reopening plan, we must use these next few days to strengthen our plans and communication channels and to build support for returning our students and staff as soon as we can safely back to our schools. Today we have the distinct pleasure to hear from our partners in the North Carolina Department of Health and Human Services. Chief Deputy Secretary Susan Gale Perry, State Health Director Dr. Betsy Tilson, and Dr. Kenya McNeil Trice, the North Carolina Pediatric Society incoming president. We thank them for their healthcare expertise in support of our students and staff in providing us with timely health consideration. The continued collaboration with these partners, as well as the governor's office, is essential to our children's education. So at this time, I'll turn the meeting over to Chief Deputy Gale Perry.
Thank you, Chairman Davis, and hello, everyone. It's wonderful to be with you today, as always. Today, we're really going to try to spend a little bit more time with you on some of the health questions that you might have. We're going to give you an opportunity to learn a little bit about some of the data and research on what we're learning about schools and children's well-being in relationship to COVID-19. And we're not going to spend a lot of time on the Strong Schools NC guidance, since I already did review that with you in detail, and I know you all are fairly familiar with it. And we're not going to get into operational and policy kinds of questions, but really focus, I think, on the health. And we know that there's a lot of questions that you all have, that families have, that educators have, and we want to try to answer some of those today. And I am really so grateful and delighted to be joined by two wonderful pediatricians today who are both truly experts in their field and nationally recognized. And I'm going to do extremely brief introductions so that we can spend the bulk of our time on the presentation and questions and answers. So first is Dr. Betsy Tilson. She's the North Carolina State Health Director and Chief Medical Officer for the Department of Health and Human Services, and a wonderful colleague to me. Just a couple things about Dr. Tilson. She completed a pediatric residency at Johns Hopkins Hospital and a general preventive medicine and public health residency at UNC Chapel Hill, and is board certified in both fields. And before joining DHHS, Dr. Tilson was the medical director of community care of Wake and Johnston counties, and as the chief network clinical officer for CCNC. Dr. Tilson has practiced primary care pediatrics for 26 years, primarily at her local health department, Wake County Human Services Child Health Clinic, and has served in many national roles. And then I'm also joined today, we're so grateful for her time because she's got a very busy schedule, to be joined by Dr. Kenya McNeil Trice. She's a professor and vice chair of education in the Department of Pediatrics at the University of North Carolina, UNC School of Medicine. Dr. McNeil Trice completed her pediatric residency training at UNC and was selected as the chief resident and pediatric hospitalist at Wake Med Hospital before joining the faculty at UNC as an assistant professor in 2007. Dr. McNeil Trice became the director of the pediatric residency training program at UNC in 2014, and she currently leads the largest pediatric residency training program in North Carolina, South Carolina, and Virginia. Dr. McNeil-Trice is the immediate past chair of the Southeast region for the Association of Pediatric Program Directors, a member of the Education and Training Committee for the American Board of Pediatrics, and also served on the executive committee for the NC Pediatric Society for 12 years, where she is currently the elected secretary for the society and chair of the Education Committee. So Dr. Tilson and Dr. McNeil-Trice, I'm going to turn it over to you.
Thank you so much. I'm really, really happy to be here with you all. And we can dig in, as Deputy Secretary Gale Perry said, into some of the health parameters and thinking through the planning and operation. We want to have you grounded pretty well in the health. We do have some slides to present to you just so that you'll have a background, but also want to be sure, as Susie said, that we have lots of time for Q&A. So I will dive in, and Dr. McNeil-Trice and I will go back and forth through this small deck that we have. Okay, on the first slide, this may be old news to you, but I think it's always good to ground in the science and the basics of viral transmission, because that's where we set all of our guidance, and all of our policy is grounded in how this virus is actually spread, because all of our policies and guidance is obviously designed to try to decrease the spread. So I think it's always good to remind us what we're trying to achieve. So the main way that COVID-19 is spread is what we call respiratory droplets. So those kind of small little water droplets or liquid droplets that come out of your nose and mouth that can then travel to another person. What we know is that those respiratory droplets they can be spread pretty efficiently if you're coughing and sneezing, but also if there's other ways that there's what we call increased respiratory effort. So if you're yelling or singing or screaming, but anything that's kind of increased the amount of stuff that is coming out of your mouth, that can increase some of the spread. The other thing that we are learning is that for there to be spread from person to person, there needs to be a sustained exposure or contact between people. And so what the CDC is currently using as its operational definition of sustained contact is about 15 minutes. And it'd be the most health protective that you are within 6 feet, within 6 feet of a person for 15 minutes. It does seem, and that's what CDC has, it does seem, and we're looking at some literature coming out of Europe and some other countries, that it may be that once you get beyond 3 feet, then that really drops off your risk. So it may just be staying beyond 3 feet. But to be the somewhat of a purist with our CDC, we are saying beyond 6 feet. But there is a little bit of a wiggle room, and we are learning more and more about this, that this may drop off. And the other piece that we are learning about this virus, as I alluded to, that if you are coughing and sneezing and having symptoms, that seems to be when you are most contagious and you can spread the virus as easy as possible. But we are learning, though, that you can spread it before you have symptoms, what we call pre-symptomatic, so about 48 hours before you have symptoms, you can also spread the virus. And also some people will have the infection but never have any symptoms. And you can spread the virus even if you don't have any symptoms. You probably spread it less when you're asymptomatic and pre-symptomatic than when you're symptomatic, but there still is a chance of spread. That's probably the main way that it's spread, but we also are learning that there are other ways you can spread it, and that's what we call this environmental contamination. And so if some of those respiratory droplets land on a surface, and then you touch that surface, you can get the virus on your fingers. And then if you touch your face, your eyes, your nose, then you're able to introduce the virus. This is probably less of a way that it is spread. The respiratory droplets are probably the main way, but this is a secondary way that the virus can be spread. So you'll see that through the guidelines, thinking through our rationale for some of our guidelines, trying to combat these two ways. The other data that we're learning, and again, I just want to say that this virus was not on the earth for December of 2019. So we are learning a lot, and every day we're learning more and more. This is the brand new virus. And one of the things that we are learning, and this is a bright spot, and really I think good news for this context, is learning more and more about how this virus interacts with children and then specifically in school settings. In the beginning of this epidemic, we were really relying on the data that we knew about flu because it's the closest thing that we had, and it was what data that we had. So we were extrapolating from flu, assuming that COVID-19 would act the same way as flu. What we're learning as we're getting more data is that COVID-19 is actually not acting the same way as flu does with kids. And this is really helpful and kind of a bright spot in what we are learning. So some of the things that we are learning is that that children are having lower rates of infection than adults. Other thing we're learning is that, and this was looking at some studies in households, that even with the same exposure, so they're exposed at the same rate potentially as adults, but they're less likely to get an infection even if they're getting the same exposure. So that's we're also learning in general, now of course we know there are some children that have had severe disease, but in general, children tend to have a very mild or asymptomatic illness more than adults. And also then we're learning is that children may be less likely to spread the virus than adults. And this may get back to that very first slide that if you have very mild illness or asymptomatic illness that you aren't transmitting the virus quite as much. So that's a really good thing that we are learning that is not great at spreading this virus, which is unlike flu. And there's been some studies looking at children who had the infection exposed to 100,000 people and not one of them had. So that's really, really, really good. Again, different things. And then we're also been looking at studies, what about the effect of school closures or schools opening. You know, that data is still evolving, but what we are finding so far is that schools have not really seemed to play a major role in transmission, and that school closure hasn't made a huge amount of difference in the spread. And we're still learning, and a lot of schools did close, so I imagine we'll be getting more data as now schools are open. But so far, we haven't seen any really troublesome signs from schools open. And then there's a really nice summary of evidence. And we have that link there. The Massachusetts and their school guidance, a really nice summary of a lot of this guidance. If you have that handy link there. Now, with some of that science, I'm going to turn it over to Dr. Trice, and with the North Carolina Pediatric Society and the chapter of the American Academy of Pediatrics, we'll talk a little bit about those recent recommendations that the AAP had put out. So I'll turn it over to Dr. Trice.
Thank you, Dr. Tilson. So I anticipate many of you are likely aware they've been very well publicized. The guidance that the American Academy of Pediatrics, or the AAP, released at the end of June, really recommending and advocating that school districts across the country prioritize in-person schooling as the newer academic years were starting. And a lot of this information, basis of this guideline was stressing a lot of factors that we already recognize of schools and educational opportunities being really fundamental to children's development and their well-being, not only from an aspect of academic instruction, but also in addressing social and emotional needs, safety, reliable nutrition, therapy that may be needed for speech or physical therapy, mental health support, in addition to physical activity, whether that be organized within athletic teams that are associated with schooling, or even unorganized recreational play that are in safe and supervised environments. We also recognize that educational opportunities are key and vital to addressing and mitigating the disparities and the inequities that unfortunately all too often fall along socioeconomic and racial lines. The AAP also recognized the negative impacts that school closures can have across the country, especially with regards to negatively impacting gains within learning and knowledge acquisition, difficulty when identifying children who may have exceptional learning needs with regards to learning disabilities, increasing the identification of concerns, whether there may be emotional or mental health, and how to identify resources, ensure those families have those resources, and then again, addressing food insecurity and nutritional acquisition for our children and families. And the access to physical activity. So honestly, the guidelines that the AAP put forward with promoting and advocating for school districts across the country to really try to prioritize plans to have in-person schooling as much as possible, while also recognizing that there are going to be students and families and communities that may be experiencing higher risk with regards to this COVID pandemic and infection rates and risk for serious morbidity and mortality.
Great. Okay, so I'm going to come back to me for a bit, and then I'll kick it back to Dr. Neil Trice. And Susan just sent me a text that people can't hear me, so I'm going to try to be better and closer to my microphone. I know that you all went through these guidelines, so I'm not going to go through those guidelines, but I just want to make sure you understand where our guidelines are tracking back to, some of the biology of the virus. So we talked about that virus primarily spreading through respiratory droplets. So if we can prevent those respiratory droplets from coming out of a person's mouth and then therefore getting to another person, that is a really good thing. And that is the point of the face coverings, is to prevent those respiratory droplets from coming out. And then if we can keep people as far away from each other as possible, ideally 6 feet, but 3 feet might give us protection as well. But that idea, that social distancing, decreases that risk of that person-to-person spread. But the cloth face coverings will reduce that amount of respiratory droplets, which gives us a little bit of wiggle room there. Cleaning and the hygiene, that gets us to that idea that respiratory droplets are on a surface and then you can touch them, so that helps to decrease that. As Dr. McNeil Trice said, this is a really troubling time for our families, for our students. It is really scary, and so that coping and resilience piece, that social emotional support piece, really important. And then I want to get to the last two, because that will flip us to the last slide, and we'll talk about high risk, which is what Dr. Trice was saying, and thinking through the accommodations for our high risk folks. One of the things that we're really going to need to think through, and you'll see in our guidance, is that there will be children for whom in-classroom learning will not be possible. And there'll be a couple different places. So one, as we think through, and let me just take a step back to say that we are all going to have to live with this virus until we have a vaccine. And that is not for a way off. So our goal needs to be not no risk, but it's going to be to lower the risk. And so we know there's going to be infection. We know there'll be infection. And so thinking through, what do we do if somebody has infection? And if someone has an infection or was exposed, again, that close contact, there are definitely going to need to be children who are out, who are isolated until they can be recovered and come back, or are exposed and then need to be out. So we do know that as we're working through handling positive cases, who need to be out, either isolated or quarantined. And then we also know that there'll be high-risk students and teachers for whom remote learning might be a better option. So for both of those categories of kids, really thinking through that robust remote learning as a complement to in-person learning is going to be really important. All right, and then I'm going to talk a little bit about high risk, some of the medical high risk, and we're going to kick it over to Dr. Trice to talk through some of our other higher risk populations. So from a medical standpoint, and you have this in the toolkit, but CDC, it continues to update and recognize what populations might be at higher risk, not so much of getting the infection, but a higher risk of getting really sick if they would have the infection. And so we know people who are older, 65 and over, and also people with underlying chronic health conditions, so lung problems, heart problems, diabetes, sickle cell. Those people have a higher risk of having complications. And then specifically, CDC calls out children who are medically complex are also in that category of having a higher risk. That subset of our children who have medical complexity. And so that, from a medical standpoint, there is evolving of who might be at higher risk. But we also know, as we look at how this pandemic is playing out across the population, that there are also certain populations that are higher risk. And so I'm going to turn it over to Dr. Gale Perry to talk about that and how this is really playing out in disparity.
So thank you, Dr. Tilson. As Dr. Tilson just briefly introduced, we have recognized this nationally, that this pandemic, this COVID pandemic, is disparately affecting certain communities and has absolutely really unroothed and increased the health disparities that we're seeing amongst communities. This information that you're seeing right here is from our own North Carolina Department of Health and Human Service, and goes to illustrate how disproportionately the impact of COVID-19 cases and morbidity are impacting our communities of color within North Carolina. And so if you notice here, our Black and African American population within North Carolina account for roughly 22% of our population, yet are approximately a quarter of our cases within that are laboratory confirmed to have COVID. Even more disparately, our Latinx and Hispanic population accounts for 10% of our population here in North Carolina, yet they are accounting for nearly 46% of our COVID positive cases. That's nearly 5 times their representation within the state of North Carolina. And so recognizing that in the communities and the children that come from these communities, while the options of in-person schooling we recognize the benefits of that, these families and these communities are looking at that risk through a different lens of how they're being disparately affected. Our next slide goes forth into further detail with regards to deaths in North Carolina, specifically from COVID. And if you will see here, again, our Black and African American community, which accounts for 22% of our population, is making up a third of our deaths in North Carolina. They are also the only population in North Carolina who have a higher death rate from COVID-19 than their representation in the population. And that is something that is very telling, especially from the lens of parents and families who are deciding, having to make decisions about the safety of sending their children back to school. Now, this data that you're looking here, as you can see, is rounded to the nearest whole number, but looking at the deaths by age for 0 to 17, just because this is listed as 0% does not mean that we have not had any pediatric deaths from COVID-19. Again, I anticipate all of you are very well aware of the young child who died from COVID in early June here at UNC, as she was a previously healthy, beautiful 8-year-old. And so while this is very rare and it's not very common, that risk for families, especially from families and communities of color, is not zero. And that is the information that we are all considering and looking at as to whether it is safe to send and to have those children back within the school setting. Next slide. And so our last slide before we go to questions are, again, talking about protecting our vulnerable populations. We've already reviewed, and individuals are likely well-versed in what places individuals at high risk for severe illness from COVID. And if you look at these bullets here at the top of this slide, honestly, within the population of North Carolina, nearly 51% of our population would fall into one of those high-risk categories. And that's something that we need to consider, whether we're talking about children or their caregivers, families, or the staff and educators within our school system. We absolutely would recommend that schools continue to systematically review all of the current plans that are in place, whether those be individualized health plans, 504s, and accommodating children that have special needs and updating those based on how those needs may be affected by the current pandemic, but also creating a process for families to self-identify as high risk, recognizing that high risks may fall into a pre-existing health condition or based, again, on this indisputable data that we have here, there are certain communities that are at higher risk, and families being able to identify that with their concerns. We, again, advocate and strongly recommend that remote or learning options be available for families who do identify for this so that we can continue to provide educational support, but also recognizing that our educators, our staff, all of our support individuals within our schools have opportunities to be supported and have remote options also. And with that being said, I am excited to take time for some questions, Dr. Tilson and I, and we'll go from there. That's our last slide.
Thank you both so much. I'll turn to my colleagues for questions.
Mr. Chairman?
Yes, Mr. Hall.
Yes, I have, to any of these speakers, what about this issue that I'm reading and hearing about the virus being airborne? Any response?
Well,
And transmission of it?
This is Dr. Tilson. I'm happy to take that. I was hearing that there was not great audio, so
Can't hear you.
I'm sorry?
Can't hear you.
Okay. I apologize that my audio has not been good, so I'm hopefully this is okay now.
Yes, it is.
Okay, sir, thank you. Yeah, there has been some recent discussion about this being airborne that we are looking into. Still seems that primarily it is, again, this respiratory droplets, but you are right, there have been some recent discussion about this being airborne or not, and we're digging into that data now, but it still seems primarily it is a respiratory droplet spread. But that is one of the things that we are looking into. And again, as this data is evolving, our recommendations may be changing as we're learning more, but as for right now, it still seems primarily respiratory droplet.
Thank you.
Yeah, I would say with the exception of, and this isn't going to be relevant to schools, but in a healthcare setting, there are procedures that what we call aerosolize things. So if you're intubating somebody or in a medical setting, there's a chance of that more airborne, but in a regular community setting, it doesn't seem like it is a major.
How would it affect sports?
I'm sorry, excuse me?
How would it or will it affect sports?
Sports.
Being airborne.
Yeah, so I think sports, even with it being a respiratory droplet,
Right.
I think we have to think through sports, right? So any sport where by nature of that sport, you are in close contact with people who may be like spitting or jeering at you, that is a higher risk. So thinking through a sport like wrestling versus a sport like maybe cross-country running or tennis that you're away from the person. I think any of that sport where there's real close contact, I think that'll be a higher risk category than a sport where there isn't that close contact, regardless if it's airborne or respiratory droplet.
Thank you.
You're welcome.
Chair Davis, I have a question of our guest. Thank you so much, Chair Davis. I'm reading the information that's underneath the caption, strongly recommend that schools implement remote or other learning options for those students who would fall into the at high risk, the vulnerable populations. There just doesn't seem to be an easy way to approach this, because the students who really would benefit need to be in-person taught, are the same, belong to the same category for the most part, not entirely, but more or less to the same category that I'm sensing are mentioned in this recommendation to provide opportunities for remote learning away out of the classroom, away from the teacher, away from this other students, the peers that have so much to do with the socialization aspect of being an educated person. It's almost like we've got a population of students who are disadvantaged of all colors and of color, who just can't seem to win in this. And it breaks my heart. I definitely, there's not a board member that would back off from the need of following the guidelines and providing the safest place for students. But I respect and I acknowledge and I know the importance of these recommendations. Your expertise is highly respected, and I take all of this very seriously. But it just still leaves me sad in a way.
I completely agree with you. There is no perfect solution. This is hard across all tenets and examples, and we are continuing to see again the children and the families that are most vulnerable to a lot of things that are outside of our control, such as natural disasters and illness and pandemics, are the ones that are disparately affected. And so I agree with you. I think there is not going to be a solution for which there is no risk. We are still learning a lot about this infection and its course. I can tell you information that we initially knew when this started for us in February and March. We now have more information and are finding out new things are true. So there is no perfect plan. I think what we are advocating for is that we consider and support those families that are at high risk, not only from medical and health standpoints, but also high risk based on the communities for which they live and thrive. And also realize that there are parents and caregivers who have that information and by sheer fact of the numbers may be assuming more risk by sending their children to in-person school than others. So how can we help to mitigate that risk? What factors can we have in place with doing so?
Mr. Chair,
Thank you very much.
Mr. Ford, may I ask a question?
Yes, Mr. Ford.
Thank you. Thank you so much for that presentation, and I want to echo the sentiments of my colleague, Dr. Oxendown, when I say that, I mean, ultimately, this is probably one of the hardest decisions I think we've wrangled with.
Yes.
And there's no yellow brick road that gives us a clear path to what to do. I do wonder, because I know that this decision, the novelty of this virus makes it very difficult to wrap our arms around, and if we're being honest, the fact that whether to open schools or not to open schools has been politicized greatly. I want to know, has any consideration been given to the potential impacts or spread amongst staff and teachers, and because on the one hand, a lot of this is the conversation is centered on the safety of the children, which is appropriate, right? That's job one, is to make sure that we protect, keep our students safe, any school. But because of the differential impacts on adults in that category where the most infections are, I think about that and those staff and teachers who belong to those vulnerable populations that you're talking about. I think about whose families have access to health care. I think about who's disproportionately contracting, who's disproportionately dying. And as Dr. Oxendown mentioned, it's the same populations. And so from the angle of staff and adults in the building, how would you assess the risk factors for them?
Yeah, I'll start with this one, but then also Dr. Price chime in, or Deputy Secretary Gale Perry as well. I think you're right? Our school community is our students and our teachers, but it's also the families that our students and our teachers go back to. So we have to think about all of those. And so I think you're right that, so one thing that, part of the good thing is what makes it decreased risk for our students also makes decreased risk for our adults. So that's helpful, that everything that we put into place can be safe, decreased risk for both populations. And I guess some of the good news is thinking through, the practicality as we think through this. So one, wearing a face covering. Adults are going to be able to do that more easily, maybe than some of our younger kids, and that can be a very effective thing, especially to decrease adult-to-adult spread. So if adults are our more efficient spreader, we can help decrease that adult-to-adult spread by having adults wear the face covering, and they also might be more able to reliably social distance. It's, you know, just to be fair, we have children, and it might be hard for them to really stay apart, but adults can do that a little bit reliably, so that helps us as well. And then I think you'll see, and when we talk about vulnerable populations, we talk about students, families, and staff. So thinking through the staff being able to self-identify as high risk and making accommodations for the staff as well. And when we talked about the recommended infection prevention supplies, we think about staff as well. I think we also need to think about the families that our children are going back to and thinking through, you know, is it a child maybe has a lone caregiver who maybe is a grandmother with high risk complications. And so I think having that flexibility of families being able to self-identify at high risk, either because of the student or the family, will be an important piece to protect our adults as well. So I think that's where you see some of that recommendation of children's family and staff being able to self-identify and then thinking through what accommodations. That's an important piece of our school community is bigger than just. I'm not sure if anybody else wants to add to that.
No, I think you said that exceptionally well. I would just advocate that as plans are being developed, that these communities are included in developing those plans, and so and by communities, the educators, these educator supports such as teacher assistants, administrators within the school. Listen to the voices of individuals who are providing the nutritional support. Our food service workers, our cleaning and janitorial staff, they're vital to our schools. We could not function without them, and their voices are important as they are also assuming risk during this time of pandemic.
Mr. Chairman.
Too.
Mr. Chairman, it's JB.
Yes, Mr. Buxton.
Thank you, and thanks to our colleagues from DHHS and Dr. McNeil-Trice. Appreciate your time and your expertise. I want to offer my takeaway from what I heard from the three of you and have you react and let me know if I'm hearing what you're trying to communicate. Based on the available data and research now on transmission, on impact on children, on the potential impact on staff, as you've just been mentioning, and what we know about how to control the spread, it seems like we have a shot to open up our schools, if not in a completely normal way, in a way that allows many students for whom it's critical to be in school to attend school. But that given current numbers, we probably have a small window to ensure that the environment is such that is a smart decision. And this is then here my takeaway, that it becomes incumbent upon us as a state to kind of meet this challenge. We've got, as a state, embrace the opportunity to get our kids back in school, to allow parents to get back to work if getting their kids in school is an impediment to that. But we have to commit to doing the things we know we need to do to reduce our infection rates, to reduce our hospitalization numbers, so that becomes a real possibility. It seems like, given the current reality, we're endangering the opportunity to get our kids back in. And so if we can do that, and as a state, whether we're have kids or not, or whether we're sick or not, commit to doing the kind of things we know control the spread, we do have a shot to get our kids back in school. And I want to make sure my read of that is consistent with what you're saying, because that's a sign of optimism if we do the right things.
Well, Mr. Buxton, this is Susan Gale Perry. It's the perfect opportunity for me to remind everyone of the 3 W's: waiting 6 feet apart, wearing your cloth face covering, washing your hands frequently. And you are exactly right, sir. I think you heard from both of our esteemed physician colleagues on this call today that we are not operating in a world without any risk, that there is risk. You've heard Governor Cooper and Secretary Cohen repeatedly talk about the best strategies we have to slow the spread, approaching this with a dimmer switch approach so that we can get kids back into school. That is a top priority, I think, for everyone because of what Dr. Oxendine and others said. We want kids to be in school. We want them to be as safe as possible. And we want the adults in those environments, all of them, teachers, janitorial staff, cafeteria workers, to be as safe as possible. So I think it is really incumbent upon all of us to take the steps that we need to take and show the leadership that we need to show to get us to that place. And as I think you saw from the American Academy of Pediatrics guidance, we're really weighing risk here. There are risks for kids not to be in school. There are risks to their physical well-being, their nutritional well-being, certainly their learning, and there are risks for the adults and children, in a world of COVID. And so, yes, it is balancing risk. It is using the strategies that we know do work, and really doing our part to try to get where we all want to get, which is kids in school and our economy back up and running.
I appreciate that feedback.
Other questions from my colleagues?
Chair Davis, I have just actually not a question, but a point that
Sure, Dr. Oxendine.
I think I spend a lot of time thinking about okay, but what if this? Okay, what if this? Have we thought about that? And so I don't want to add any fear to the laundry list, but here's my thinking, because we seem to be at the stage of always learning something else about COVID-19. Every day, something else. Seems like what I'm hearing is we have a younger population being affected. I don't think the mortality rate is as high, but that's where our increases, we're seeing our increases in like maybe a 30 to 40, 50.
I can't hear anymore. Did the volume go?
Dr. Oxendine, are you still on?
I'll work on getting her back, sir.
Okay. All right.
Perhaps.
Wait on our colleague, do we?
Yeah, I'm not sure what was going to be the finish of that, but I think as I'm hearing a lot of the comments from the board, and honestly, it sounds like we're all saying very similar.
No, I'm still here. You probably thought, oh my goodness, that was not a good sign.
All right, continue.
I'm so sorry. No, my this is a bad omen. Maybe I should not complete this. My battery
Good is
died.
that you came back.
I know.
You came back.
I can
Go
hear
ahead,
I can hear the sirens coming down Interstate 95 now. No, so my point is this. I think we need to be thinking about, I don't know the average age of our teaching force, but I would imagine it's, I don't know. We've got to think about the at-riskness of our age 45-year-old teachers and what that means in terms of their having to stay out of school for a while to recover, maybe to be in the hospital, recover from that. Added to that will be the need for, this is called domino effect, is the need for healthy substitute teachers in the event that we have a considerable, a significant population of teachers who are going to be out of school for a while. So just more to add to the plate of decisions and where our thinking as a 13-member board, that's where our thoughts are around all of those issues. I just wanted to raise that point because, I'll share just a little bit of personal information. I know several young people right now who are really young, because I'm much older, who are really struggling with this virus. And I predict that we will have a number of teachers who may unfortunately find themselves in that predicament in the next 3 to 6 months. So that's my point. And I'm here to stay for the rest of the afternoon.
Thank you. Thank you very much. You brought up very important points that I believe all of you recognize. I would just encourage, and it's one of the things I've had to learn as being a program director and a vice chair, and us doing significant planning when this pandemic started and continuing to adjust, is that plans and policies that are put forward need to be nimble. And the two words that I've used consistently as we progress through this is adaptability and resilience. We need to recognize that something that may work for us at one point, we may have come to a short place down the road and find out that that we need to adjust, and we need to adjust quickly. And so that's one of the things I would encourage us as a community, and you as a school board, and recognizing there's going to need to be some adaptability and resilience as we get more information and see, how our state progresses. And right now we're focusing on a talk about COVID. Mind you, North Carolina has not experienced COVID in the middle of our true viral season with October, November, December. And so individuals may be out due to COVID, but if you get a fever and a cough, you may have the flu or the common cold. Given our concerns, that still may put you out of the classroom until you prove otherwise that you don't have COVID and are asymptomatic. That's hard. That's going to be hard not only for our teachers and support staff, but also for our students who may have extended days that they miss from school from viral illnesses that are completely unrelated to COVID. So sorry to throw another one in the mix there.
Thank you very much.
That's what we're preparing for at the healthcare system. I was like, we have not had COVID and flu at the same time. Oh my goodness.
Well, we thank you all three so much. We know you've got another appointment at 2:30 you've got to get to, but flexibility, nimble, and resilient. You just described our teachers.
Absolutely.
That's how they practice their profession.
They are heroes.
We thank you for sharing this. We appreciate how we can constantly learn from you as you learn and adapt our guidance. And we, most of all, just appreciate your partnership on behalf of our students. Thank you very much.
And
Thank you for having me.
Yeah,
Thank you.
if I could just chime in one out of that piece, and I think what Dr. McNeil has ended with is so powerful and so important, that we are learning more and more, and we can plan with the best data that we have, but as that changes, we can change. And so I don't want us to think through, oh, it was a failure or a mistake. I think the one thing that we for sure can say with certainty is that things are going to change. We're going to learn more, we're going to have to adapt, we're going to have to change policies. And so us embracing that idea that we know change will happen, we know we'll learn more, and that is our opportunity to learn and improve, and not that we got it wrong the first time. We're all working with what we have at that time, because that is absolutely, for the next year, we will continually be learning more and changing. And so thinking through that, coming into this as one certainty will be change. So get ready, us getting ready for that, and to be nimble and flexible, and that change doesn't mean a failure. It just means we're learning more and we're getting.
Chief Deputy Secretary, any closing comments?
I think that was the perfect end. We're learning more and we're getting better. I think that's the key. We're getting better. And we'll do this together. We'll get through it together.
Absolutely.
Very good. Thank you all. Appreciate it. Have a good day. So that brings us to our final committee of the day, which is our Student Learning and Achievement Committee, and I'll turn to the chair of that committee, Mr. Buxton.
Thank you, Mr. Chairman. This is J.B. Buxton, and I'm joined the SLA committee by Dr. Olivia Oxendine. We have 4 items on the agenda today. Our K-12 social studies standards adoption item and a K-3 reading definition for approval. Those are our 2 action items. We've got a discussion item on the reappointment and replacement of compliance commission members, and 1 consent item dealing with CTE textbook adoption. I want to start with the SLA 1 K-12 social studies and remind board members of how we got to the point today. We've been looking at the social studies standards that have been in development. Last month, in looking at those standards, we asked the department to come back and present some additional information related to the introductory paragraphs to each of the social studies standards. We had some conversation about the inclusion of diverse perspectives and what more we could do to ensure clarity about those perspectives. We also asked them to talk with us a little bit more about the installation process and the production of guidance documents that helps the field to implement the standards. And then finally, some understanding of the commitment to building diverse perspectives into the development of those guidance documents. In addition, over the past month, there has been a lot of commentary from the public, given that these are social studies standards and deal with civics and government and other issues. I think it's been germane and appropriate that we've heard a lot from the public about these standards. We've heard a lot from board members. I have with questions about the standards. And as I think we've discussed before, a lot of questions, not just in our state, but across our country, about the degree to how we go about teaching our history and social studies, the perspectives that are included, the issues that are addressed. And while these are not new questions, they've certainly developed a new set of urgency. And as a state and a country, we're reckoning with these issues. And so this adoption comes at a particularly compelling and important time. And so given that, I've asked the department today, Dr. Oxendine and I have, to present not only some responses to the questions and issues we had asked them to come back with this month, but also in recognition that we've given them about a month to address significant questions about the teaching of history and social studies, what the implications would be if we gave them additional time to continue to develop and revise the standards to come back at a later date, and what implications that has on the courses that are offered this coming school year, the standards that would remain in place. And so with that preamble, I'd ask Dr. Stigall and his team to take us with all deliberate speed through the slides, and then we can get into some discussion about where we stand with these standards and the direction we want to give the department moving forward. Dr. Stigall?
Thank you, sir. We do appreciate that we're running late on time, and we want to make sure we're as deliberate as possible with answering your questions. I've asked Dr. Lori Carlin, who is the section chief for the social studies and art ed. She's going to do the presentation. I'll be available to chime in as well, but her team has worked diligently on this, and it's been a year-long process, as we know, but I'll ask Dr. Carlin to start us off, and as needed, I'll make some comments.
Thank you so much, Dr. Stigall. Thank you, Mr. Buxton. Good afternoon, Chairman Davis, Superintendent Johnson, board members, advisors, and other stakeholders. I'm so pleased to be back before you today to share some additional considerations for K-12 social studies standards. I'd like to, again, thank all of those who've been involved with this work that continues to take place to ensure that we have quality standards in place for North Carolina public schools. In particular, I'd like to thank Dr. Stigall, Dr. Mullinex, and Ms. Train for their support and guidance throughout this process. All three are here with me today to provide additional contextual guidance. The social studies team includes Michelle McLaughlin, Justin Knox, Felicia Sanders, and Tom Daugherty, who joins me on the call today. It was exciting to hear from students this morning who are actively engaged by the curriculum made possible by a passionate educator. When we presented in June, we shared the overview for revision of the K-12 social studies standards accomplished using the process detailed in State Board Policy SCOS 12, a timeline of activities, the Draft 3 standards, and a general installation plan. After the June meeting, the team was asked to provide some additional information. Since then, we've shared all drafts and public review feedback, crafted an inclusive statement to be reflected in the introduction of each course, and provided a standards inclusivity analysis to the board. Today, we will be sharing those along with a clear timeline and strategic installation plan. Before we dive into what an installation of standards would entail, it will be helpful to have a clearer view of the difference between standards and curriculum. At this time, Dr. Mullinex will highlight some of those key differences.
Thank you, Dr. Carlin, and thank you to our earlier presentation this morning for pointing out the value of choosing challenging standards-aligned curriculum that brings students to a greater level of discourse and critical thought. That leads us well into this portion of our presentation, in which I'd like to take a few moments to distinguish between standards and curriculum. When thinking of the terms standards and curriculum, it is important that we distinguish between the two to include the entities responsible for each. Standards are what we want students to know and be able to do. These are the end result. For example, we can say that each student will run a 5K by the end of 3rd grade. The goal is that the student will finish the 3.1-mile run. How we get to that goal is going to be the curriculum. Ainsworth defines curriculum as the high-quality delivery system for ensuring that all students achieve the desired end, the attainment of their designated grade or course-specific standards. The curriculum for that race could be a Couch to 5K program. It could be a daily walk and run and healthy eating plan. It could be something else. That is what will make the difference in getting to that goal of finishing that 3.1-mile run. The how is really the major piece of the puzzle. Without the how, the what or the standard will not be met. So as you look at this current slide here, you see 3 different arrows. You see one with standards, one with curriculum, and one with instruction. The standards are the North Carolina Standard Course of Study. Those are adopted at the state level. The curriculum is chosen at the local education level. You see that in the middle box there. And the instruction is determined at the teacher level. Going back to the standards level, as I mentioned, you see that that's the Standard Course of Study. That's what we're discussing here today, our social studies standards as part of that. It would be at the local level that the curriculum would be determined. And if you look on in that middle box, you'll see that could be text, lesson plans, activities, tasks, or classroom assessments. Moving into the right, as I mentioned, that's the teacher level. And that can be a variance from classroom to classroom, from grade level to grade level, from school to school, from district to district, and so forth. That includes the delivery of the instruction, the various approaches of that delivery, strategies that are used to teach the curriculum, and differentiation. But it is not limited to those. Let's look at that a little bit more closely with a specific standard from ELA. You see the state standard RL 5.3. Compare and contrast 2 or more characters, settings, or events in a story or drama, drawing on specific details in the text. Again, that standard is determined at the state level. At the local level, perhaps the LEA would choose one of these items mentioned underneath curriculum. Thunder Rose, Amos and Boris, Mr. Griggs' Work, The Call of the Wild, Charlie and the Chocolate Factory, or Maniac McGee. Again, it is not limited to those. Those are just possibilities that the local level could choose to help meet those state standards in teaching. Now to explain that a little bit further, we have the same state standard, those possible reading selections, and then we get down to the instruction level. And this is where it really gets down to the nitty-gritty of what is actually being taught in the classroom, what the students are exposed to, and how they get to showing evidence of the learning target or our state standards. I'm not going to read that to you in detail, but I do want to point out that that again will vary from teacher to teacher, classroom to classroom, school to school, grade level to grade level, and so forth. At this time, with that being said, I would like to turn it back over to Dr. Carlin. She is going to continue this presentation, and she will provide an overview of some of the State Board requested clarifications that were requested in the June State Board meeting.
Thank you so much, Dr. Mullinex. We would like to go ahead now and move to the proposed introductory statement promoting inclusion. I'm sorry, if we could go back one. I missed a slide there. Thank you. In accordance with SCOS 12, our approach to standards revision was feedback-based, research-informed, improvement-oriented, and process-driven. One of the things we heard at the last meeting was that it was essential to ensure that the standards were crafted in collaboration with multiple educators from diverse areas and backgrounds. As reflected in this slide, our writing and review teams were comprised of educators from all 8 state board districts, and we had tremendous feedback from the field over the course of the 83 days of open public feedback. These are the voices that are echoed in the standards. Additionally, these educators and other stakeholders will be instrumental in reviewing the resource documents and professional development that is the next step in the process. In order to ensure complete representation of all of the voices in our state and further demonstrate the state board's commitment to inclusivity, we were asked to draft a statement to include in the introduction to each course. The proposed statement reads, when planning teaching and learning, educators are expected to include diverse histories, experiences, and perspectives of racial, ethnic, gender, and identity minority groups, as well as marginalized, undervalued, and underrepresented groups, including, but not limited to, African Americans, indigenous populations, women, Latinx, Asian Americans, MENA Americans, and LGBTQ+, in order to create an inclusive school community where students are respected, valued, and welcome participants. Students come from a variety of social, racial, ethnic, cultural, and religious backgrounds and deserve to learn and be empowered by historical experiences and contributions of multiple groups. At the board's request, we propose including an inclusivity statement in each of the introductory paragraphs of the adopted standards. As we look to implement the standards after a full year of installation, we thought it would be helpful to recognize the roles various entities play in that installation. Our responsibility is to implement legislation and policy, facilitate the development of standards, provide support and training, and ensure ongoing support is available. The district is responsible for determining local scope and sequence, making decisions about local curriculum and materials, providing resources for teaching and learning, curriculum coaching, and making educators available for professional development provided by DPI or other organizations. Each school is responsible for further unpacking standards, determining appropriate instructional pacing, developing lesson guides and student learning experiences, and engaging in professional development opportunities. The timeline for this process is, again, 1 year of installation, 1 year of implementation, where schools are expected to be using the new standards, and then full implementation with ongoing supports after that. In June, we were asked about the timeline for providing supporting resources to the field. In response, we developed an aggressive approach to working with teachers from across the state, institutions of higher education, and other stakeholders to develop professional development and resource documents by spring 2021. As you saw in the Friday update, districts will continue to teach the traditional as well as the non-traditional in order to fully engage students. This slide provides an example that shows in the second column many of the traditional topics teachers would typically use as default content to teach these objectives. And in the last column, some of the lesser known or non-traditional content that should also be considered. Because a great deal of the non-traditional content allows for the inclusion of marginalized people, lesser known events, and hidden or forgotten histories that tend to not get taught because the history books and materials do not typically include them in how history and social studies is presented. DPI plans to provide this type of support for teachers to have as they look to select topics and develop lessons. In closing, we've provided the updates requested by the State Board of Education at the June meeting. Our recommendation is that the State Board of Education approve the proposed standards. We will continue to share ongoing plans for supporting our districts and charters in successful implementation, and will provide regular reporting on those efforts. At this time, we'd like to hand it back to Mr. Buxton for any discussion.
Thank you, Dr. Carlin and Dr. Mullinex, and congratulations on your new role and title at the department. I should have mentioned that at the outset.
Thank you.
Appreciate your service. At this time, I'd like to get a few questions, comments from the board, and then I would ask the department after that time to continue with any conversation and updates to us about what a delay of a year would look like. But first, let me get some comments from the board, and I believe I have Principal Matthew Bristow Smith.
So thank you, Mr. Buxton. And like so many, I'm grateful for the standards revision process and the agency's commitment to ensuring that we improve how we teach social studies in our North Carolina public schools, and that we present a full rendering of American history, the diverse perspectives, the lived experiences of the American story. So I know that we're on the path to doing that. I know a lot of work went into this current iteration of the social studies standards, and certainly I know that Dr. Carlin's team has been very busy from June to July making these updates. And so I'm especially grateful that so many folks within the agency and in the field have had a role in getting us to where we are today. That said, we have heard from such a multitude of educators on this issue. And of the 50 to 75 emails and phone calls I received on this issue, I have not had a single educator or parent advocate who has called for implementation this year. I haven't had a single one. Our educators and our parents have spoken with a clarion call to me and to us, to our advisors, that they want our North Carolina public school children to learn a more robust and complex and diverse and representative, and in many ways more profound rendering of American history. Given the contemporary civil rights activism underway in the public sphere, the equity resolution that we reviewed just this morning on the board, and given the tremendous and clear advocacy from so many educators and parents, I still believe we have a significant next step to take with these standards. As I also shared last month, new standards and any instructional materials, installation or implementation related, they're only as good as they are put into practice. And we had some discussion last month about the critical importance of that implementation toolkit that I think Dr. Carlin was referring to earlier. So I believe there'd be great interest in the field on fully vetting a toolkit that would accompany these standards before they were scaled statewide. And my hope and request would be that should the board decide to delay standards implementation for some period of time, that we could create a revised timeline that would include the implementation toolkit such that districts would have as much advanced time as possible, perhaps in mid-spring, sometime mid-year next year, to roll out the standards and the toolkit in time for professional development to be set in motion before full installation and implementation. So I think that kind of captures my thoughts on this matter. Thank you, Mr. Buxton.
Thank you, Mr. Bristow Smith. Appreciate your advising, as always, in profound ways for us from your experience in the field.
Mr. Buxton?
Please.
This is Mr. Ford. If I may briefly just offer an interjection as well. So I think I have expressed over the course of this process my appreciation for the diligence, for the socially conscious effort and lens through which all of those who worked on these standards have approached the work. It's no secret that I am one of those who still believes that this requires some work, and I want to express where that's coming from. One is I'm grateful for the presentation and, providing the distinction between what are standards and what is curriculum. That's something that very few who perhaps aren't in the education field may not understand and sometimes conflate, and so I want to thank you for that. On the topic of the standards, that is what we want students to know and to do. There just, for me, is still too much variance that would leave up to the individual discretions of teachers and of districts what particular components to include. And as an increased demand for specificity arrives around teaching the rich and diverse histories of historically marginalized groups and the representation, as well as the hunger for those perspectives embedded in every aspect of every subject matter, not just social studies, I should add, as we heard expressed from the students earlier today. I still require in my mind, in order to have a level of comfort around these, specific words, concepts that, some may say could be reserved for the unpacking standards or guiding documents, that I frankly think need to be included in standards themselves as we cast a vision for what we want them to know. Obviously, there could be left room to get more granular, to distill down even further with specific events, characters, ideas, concepts. But, as we talk about the standards themselves as being learning targets, it for me, still lacks something to be desired. And it'd be my personal opinion. And I think that, as a board, we've heard from a plethora, as Mr. Bristow Smith mentioned, of other stakeholders, including educators, parents, students themselves, that this moment, frankly, calls for that sort of intentionality around what we want students to learn. And so it'd be my personal position that we would delay this, not under the desire to go back to the drawing board, but rather to go back through with a fine-tooth comb and refining even more so with equity in mind, how we want these learning targets to reflect the demands of this current moment and the demands of so many stakeholders and communities that are historically marginalized, to make sure that we are producing more socially conscious and empathetic individuals to help create a better, more perfect union. So I just wanted to get on the record those comments and again express my appreciation, but also to clarify my position.
Thank you, Mr. Ford. Board members or advisors, other questions or comments?
This is Mariah Morris, and I have a comment.
Mr. Morris, please.
I agree with both Mr. Bristow Smith as well as Mr. Ford. I too second what Mr. Ford said. I appreciate all the hard work from DPI, but like a lot of teachers have written in to the board members, I just want to publicly state that every teacher I have heard from has asked that these standards be postponed a year for two reasons. One, because of the confusion of how school is going to look next year due to COVID, it's a really difficult time to implement new standards, as well as number two, the fact that we really need to pay attention to how we are strategically making teaching the hard truths of our history a shall and not a may. I think by including these standards, these hard, difficult items such as slavery and Jim Crow and a lot of the different racial equity anchor terms into our standards and not the implementation guide, we will be protecting our teachers from any backlash that they might receive from community members or parents that might be upset with them teaching that. And I think that's really important, to give our teachers a safe space to teach these different items, seeing from all the social unrest in our nation right now that these are difficult and sometimes triggering truths to teach. And then also by naming them in the actual standards, we're also making it easier for any beginning teachers, lateral entry teachers, or anyone just new to the classroom to be able to find these terms and find the requirements with accessibility and easier than if they were embedded into an implementation guide.
Ms. Morris, thank you. As always. Dr. Oxendine?
Thank you, Mr. Buxton. I have a split screen on this entire topic. That doesn't mean that my computer's dying, though, by the way. My split screen is this. I know I don't pretend to be an expert on standards versus curriculum, but I do know quite a bit about those concepts, and I've had a lot of hands-on experience designing and assessing. So I know a little bit about the topic. that I'm about to take a minute to talk about. A standard is setting up some benchmark for mastery and achievement and concepts that are important to teach, and hopefully students will reach some level of mastery and understanding. When we move in the direction of loading up standards with topics, then we no longer have standards. We have taken standards and we have reshaped them into curricular goals. That's one point. My second point is this. If we move in the direction of standards becoming quasi-standards and looking more like a list of grade level themes that consist of various topics, could be around slavery, could be around Jim Crow, could be around, I can give you 25 topics, folks, right now, related to the culture and history of Lumbee Indians. And I'll multiply that by the other 7 tribes in North Carolina. And then I will also say to you, who is going to be at the table to decide which of those events, which of those historical moments, which of those important topics related to the Native Americans in North Carolina are going to make it into the, I will go ahead and call them topical standards, and they are no longer. That is not a standard, folks. We need to, first of all, be sure, number one, I am not opposed to revising our standards if it's going to close gaps, fill voids, and bring to our students a full body of history. I'm not opposed to that, but I am concerned about going down a pathway where we're going to be looking at our standards as the carrier of topics, because therein is going to require a vetting team, a group of people who would need to come together and decide how many of these topics, issues, events, important moments in the culture of Lumbees, or it could be the Coharie or the Eastern Band of Cherokee or any of the other tribes, make it into the North Carolina Social Studies standards. My final point is this. It's not a major point, but it's one I want to raise, and it has more to do with the State Board of Education policymakers as we are. I'm a little bit concerned about, and I can live with this, but I just need to say it, about delaying. What does that mean? Does that mean the current standards that we approved several years ago, are they going to be tabled, or will the teachers move forward with the teaching of the current standards? Where does that place our current standards that are in operation today? But my greater point is going back to standards versus curricula. Thank you, Mr. Buxton.
Dr. Oxendine, thank you. And let me, in order to keep us moving, suggest something, and then obviously keep the floor open for comments and questions. If we could go back on the slide that everyone is looking at, Ms. Townsend Smith, to the one that has the installation and implementation. I think it's right. That one's fine. That one's fine. Actually, let's go to the other one you had. I'm sorry. So we are in an installation year, not an implementation year. And for that year, I think it's close to where we were. And for that year, we're going to have guidance documents that Dr. Carlin and others have mentioned. Here we go. Looking into it, and I think another slide shows us in maybe February or March having guidance documents. There we go. We're late in the fall, and then in the winter, professional development, so that we're on target for a fall 2021 implementation. And I don't believe what I'm hearing from board members or nor what I've heard from public comment through email has been starting this process over. What I've heard is a chance to revise in light of the questions that are swirling today, but also with more of an eye to what the unpacking documents and indicators will look like. And so if you looked at the prior drafts that the department provided to us, you saw indicators and some examples of how it might be implemented in a classroom. We don't have that on the current standards document. And I believe for a board, if we had a chance to standards and the guidance documents together in, let's say, February or March of 2021, and then come back and approve then, and then build the professional development documents and other support documents that these two columns from the winter and the spring of 2021 call for, we can substantially remain on schedule for implementation. But what we've done is be very clear and transparent to the public about what is expected with these standards, and to respond to, I think, Mr. Ford, Ms. Morris, and Mr. Townsend Smith, very clear about what the expectations are related to the implementation of the standards. And so if we were to do that, what I'd like to, and out of respect for the requests of some of the speakers thus far, is have, I think would be Ms. Shaw Coltrane, detail what the next year would look like in terms of impact on graduation requirements, because there would be some impact. So the board has a full understanding of what pushing the adoption of these standards until later in this school year at the same time as the guidance documents, which again would keep us on track for implementation, but would have some impact on graduation.
Thank you, Mr. Buxton. This is Sneha. Hello, everybody. So yes, if we were to, if you all choose not to approve the standards as they are currently, and to have the department along with stakeholders refine the standards in the next few months, and then bring back, towards the end of the winter of 2021 with implementation resources, we do need to make some policy changes. Because if you recall, back in December and January, due to the legislation regarding economics and personal finance, the requirement of only 4 courses, we had to do things a little differently. We had to adopt the grad requirements prior to standards because of helping, in order to help our school districts and our public school units plan. So this is where the board goes. Let me share with you some of the changes that we would actually need to make today. But before we get to that, we did want to survey our LEAs and charters, just so that way we can have better information for you all to understand what, how they saw this potential change. Overall, they felt like they could manage the changes required by the delay, and that there were about 10 to 15% of the respondents that said it, however, will be incredibly challenging at this time with the school year beginning in the next few weeks. What we saw through their comments was that a benefit, as Matt and Mariah so eloquently shared, was it would, and others on the board, that it would offer some time for additional refinement, especially during this really unique and historical time that we're in, and that it would be less change during COVID-19. Some of the challenges at the same time is that it will take significant communication to families and students because schedules have been set. All of the social studies changes from January were difficult to integrate, and so that would just take some time to share that, but we wanted to make sure you were aware of that, since you may get some of those calls because it'll be kind of last minute changes. But again, overall, most of the school districts and charters did feel that they could manage it. However, there were some that adamantly asked that we not, that you all not change anything else. So if the board were to decide to delay the adoption of the standard, what we would need to do is for grad 004, and we actually have made those detailed changes. I believe Ms. Townsend Smith has that ready for you to look at, but it will take some changes back to the grad 004 policy. What would happen is that the current graduation requirements would be delayed for a year. So instead of the, so for the 2021 entering class, which is this class, they would have 20, can you go to the next slide? I'm sorry, Deanna. Yes, thank you so much. If you can go back, thank you so much. I apologize. So for the entering class of 2021, they will have a mix of the four required courses. And remember, the legislation states that we can only have 4 social studies graduation requirement courses. And they will be a mix of both new and old courses. So they would take one founding principles course, either the new one or the old one by the time they graduate. They would take one American history course, either the current American history courses or the new one that would be adopted next year, the world history course, and then the economics and personal finance course, which you approved last month. We would ask that the board take a unique step and recommend starting with world history for incoming freshmen, since that will be the course that the team predicts that will have the least number of changes. So that way, to Dr. Oxendine's point, that we will still have the current standard course of study with the new one coming in a year. We would want students to experience as much of the new standard course of study as possible. Then for the students entering the following year in 21-22, those freshmen, by the time they graduate, will now have the 4 full new courses. The founding principles of United States of America and North Carolina civic literacy, which is mandated through legislation. They will have American history, world history, and then the new economics and personal finance course, which is also legislated to begin this year with this year's class, but would continue forward. And that would be for the standard future ready core course of study. Then for our occupational course of study students, what we will need to do is for the 2021 school year, this school year, they will have to be required the founding principle course, either the old or the new one, and the economics and personal finance course. They will, because economics and personal finance and the founding principles are required, that is how their 2 credits will be. For the 21-22, we will actually, the staff's recommendation is that the board actually unapprove the graduation requirements that we approved in January for OCS, because what they would like to do for 21-22 is to align the occupational course of study preparation courses with the content areas. So those are the primary graduation requirement changes, and I'll pause here.
Thank you, Ms. Shaw-Coltrane. So board members, let me get questions on what a delay in the standards, to have the standards come back in, let's just say the first quarter of 2021 to be approved along with the guidance documents, what it would mean for communication that needs to go out about the courses that students would take starting this coming school year, as Ms. Shaw Coltrane has detailed. Questions from the board? Okay. Hearing none, what I want to suggest is that because we are in an installation year, we have the opportunity to give the department the time I think they deserve to wrestle with the kind of questions that are being raised and the issues that are in front of us. Again, we are not new to this, and it is just new urgency, but also give the department a chance to be a leader in the country on these issues. And the schedule works in our favor to come back, again, not to start from ground zero, but to take not just a shot at what revisions we might want in the standards, but also to be able to put the clarity into the guidance documents that gives everyone a clear sense of where we are heading with social studies and history and American history and world history and founding principles. And it would be my recommendation to this board that we provide that additional time that I think the department deserves and that many of our teaching constituents are asking for. And that tomorrow, instead of voting on the social studies standards, we vote to amend our graduation requirement communication for the next two classes, consistent with what Ms. Shaw Coltrane has shared with us to be sent out to the districts. That's what I plan to recommend as a amended motion for tomorrow. So before we finish this agenda item, let me just get any questions or comments on that before we go to SLA 2.
Mr. Buxton?
Please.
Two thoughts. The first one is, the first one will lead to the second question. I understand what standards are generally, but in the context of history, and I guess specifically we're talking about American history here, and I think this is part of at least some of the emails I'm seeing, it's part of the issue, if you will, is before us, is how do we define standards as opposed to curriculum or implementation? So, I mean, and I paid careful attention to the presentation. I understood what was presented on standards, but as applied to history, it doesn't seem to be entirely connected. Or I am slow enough that it wasn't entirely connected for me. So I just posed that question as a thought. Second question, and I suppose the answer, I believe the answer is likely no, but the more we've discussed this, I've had the question in my mind, given the changes brought about by the personal finance course scheduling, which the legislature believes, and I understand certainly there's a lot of impetus for that belief, is a very important course for our young people. Is there a way for the founding principles course to be tooled in some manner that it covers the period of American history up until the time through the implementation of the Constitution, and then American history, what would then be denominated the American history course, would be covering the period forward from that point in time. That is, the founding principles instruction could be within the instruction of the historical developments that led to the document, ultimately, in particular the Constitution, the guide, and certainly could work in state constitution into that as well. I doubt that's workable, but the more we talk about this, the more I try to think a little bit wider outside just the constraints that we appear to be in.
Thank you, Mr. Duncan. Let me ask Dr. Stegall and his team, or Dr. Carlin specifically, perhaps, to address that. I do know there's some challenges with that, given the civic literacy component in the course, and I believe there's been discussion about that prior. But Dr. Carlin, Dr. Stegall, any comment on that?
I'll jump in. So I think what I'm hearing ask is the founding principle course, could part of the, will part of that be covering the foundational part of our country before the American Revolution? Is that what I was, or the or Constitution being signed? Is that what we're saying? Is that what you're asking? Because yeah. So if you'll remember the concepts, we had U.S. History 1 and 2, and we had the civics course. The concepts that were in place before are in place now with the American History course and with the Founding Principles course. The Founding Principles is and Lori, please jump in here. The Founding Principles course contains a lot of those early years of our country's development and the rules and the laws that were in place at that time, how it shaped the way our country ended up going through the revolution and all that happened after that. So I think a good portion of it is in the Founding Principles course. But Lori, can you add to that?
Sure. Some of the old founding principles included, it was civics and economics. And since the economics portion was placed into the economics and personal finance course, there is room in the founding principles course to cover some of those pieces, especially as they apply to the legislated elements that are in founding principles. So those things are present and can be discussed and should be discussed within those standards that are part of that legislation. So your request is in those standards.
And this is
Dr. Carlin.
Superintendent Johnson. I'll just echo that because that is something that from very early on in this process we made sure would happen, because there was a lot of confusion about this idea that we were reducing American history standards, and we did not want to reduce anything. So we did put early standards into the founding principles.
Thank you. Board members, any other questions before we move on to the next item?
Mr. Buxton, I have one other question before we leave this topic or this item on the agenda. I want to be sure of one thing. I want to, are we talking about revisiting this delay? During this delay, will this be revisiting all of the grade levels K through 12? Is that what we're aiming to do?
Yes.
Okay, part B to that is then I need to know that we are going to bring together a body of people that will address the issue I addressed. If we're moving into the world of a topical set of standards, and there's no such thing really, then I want to know who is going to be the final decision maker as to what topics make it in each grade level set of standards. Can the department provide that information? I just need to know how this around the table work is going to look. The thinking process, the selection process of topics, and so on and so forth. Because to me, that is the reshaping. That work in totality is a major reshaping of our social studies body of work.
Thank you, Dr. Oxendine. I think that's an important question. I don't want to suggest that we are, as a board, talking about a topical definition of standards or whatever the phrase was. I'm merely suggesting that we have a chance to revisit the standards, not only to give the department additional time to look at the content of the standards, perspectives that inform them, what is in there, but also to bring the guidance documents, which Dr. Carlin detailed earlier, at the same time as the standards, which presents a full picture for our teaching public, for our student public, for our public at large, as well as for this board, to understand what we're passing, not only in the standards, but the guidance documents that will help guide their implementation. So I think you raised a good question about what that process will look like. I think it would be important for the department to come back potentially as early as August I would leave that to the department about timeline for what their timeline will be to bring these documents back to keep us substantially on track for implementation in 2021, and responding to your question about how additional perspectives or voices will be included and decisions will be made. I think probably both for the standards and the guidance documents for any revisions they'd suggest.
None of those entities can be separated. They all interconnect. And I would just ask my fellow board members to just, if you can, I've sent a quick note in the chat box. That's my final point.
And I'd say amen to that chat note.
Thank you.
Board members, I'm gonna move us to SLA 2, which is our K3 reading definition. And again, just to tee it up for us, this has been in development for many, many months, and appreciate the hard work of the department to engage a significant body of stakeholders on this. We saw this definition last month. It also is a definition that the task force that Dr. Ann Clark and Dr. Crystal Hill led for us, there is a definition that they suggested as well. It is my understanding that since the time we published the documents, we've had even some additional suggested revisions from a couple of the nation's leading literacy experts, one of them Dr. Barbara Foreman, and I think the other one out of the Harvard Reads Project. I think the definition has attracted some attention in a positive way, and folks suggesting some additional, I think, non-substantive, more strengthening potential additions. So I'm going to ask Dr. Stigall, because I believe Dr. Gayle was not able to be with us today, Dr. Stigall to kind of walk us through this item, including the potential additional language that they'd suggest be included.
Thank you, Mr. Buxton. I know there have been a lot of questions about the definition being a K3 definition, and there is obviously a lot of angst about to being too narrow or too broad. So this has been a several month journey, and we appreciate all the stakeholder input. It has been quite a number of people from classroom level, university level, practitioners, professors who are teaching it, national experts, as you've shared. We do know that birth to kindergarten in particular is, although there are distinct differences between what goes on in a kindergarten through third grade approach to reading it compared to birth to kindergarten, there are distinct differences between those, which, birth through kindergarten in particular focus on receptive and expressive language skills through rich conversations, building text interactions, phonological awareness, concepts of print, alphabetical principles, those type of things. We do support a definition that is as focused as possible and can be adapted by our team to work with, as we work with our early learning staff, our high school staff, our middle school staff. We can provide guidance on what this definition for K3 would look like for those individual grade clusters. We did, as was mentioned, receive a slight tweak in structure of the definition that does not include substantive changes, but it does strengthen the definition. Dr. Jimmy Kim, professor of education at Harvard University and Reed's Lab, at Harvard, as well as Dr. Foreman, were supportive of the definition we had, and they suggested one slight tweak, and I'll read that to you in just a moment. Dr. Kim, in particular, from Harvard, suggested adding a sentence at the end of the definition, which makes minimal changes, but it ties it all back into the focus being on the goal of reading comprehension and empowering students to become deep readers with word and word knowledge. It didn't, again, drastically change the definition at all, and is actually in line with our stakeholder input. It does not negate any stakeholder input that we've had so far, and we feel that it would deeply and greatly enhance it. So the definition, just a slight tweak, you see on your screen the current definition, the slight tweak. Pull that up just really quick, I apologize. I'm going to read it as a whole, but here let me define what has happened, and then I'll read it to you. we just moved sentence structure around. They felt like it flowed better when we moved parts of this, some that was at the end, combined it with one of the upper sentences, and then one additional sentence was added. And I'll let you know when I get to that one additional sentence. So what I'll be reading first is just a reorganization of the text in a way they felt flowed better. And it reads, high quality reading instruction is grounded in the current science of reading regarding the acquisition of language, which includes syntax, semantics, morphology, and pragmatics, phonological and phonemic awareness, accurate and efficient word identification and spelling, word knowledge, and comprehension. High quality reading instruction includes explicit and systemic phonics instruction, allowing all students to master letter sound relations, and is guided by state adopted standards and informed by data so that instruction can be differentiated to meet the needs of individual students. What was added and what we're proposing to be added at the end from our national experts are this last sentence. Ultimately, the purpose of high quality reading instruction is to empower all children to become deep readers who have the foundational skills and word and world knowledge to read and understand increasingly complex text. So again, there was just about 14 words added just to bring it all together. And we feel comfortable. It's the definition that you've been looking at and we've talked over a number of times, and we're proposing this to be adopted by the board if you so see fit.
Dr. Stegall, thank you very much. Appreciate that. And thanks to your team for the work, and good to see external folks paying attention to the work the department is doing on this. Board members, I'm glimpsing the finish line in the near distance here. Any questions about this? All right.
Mr. Buxton?
Yes, Mr. Chairman.
This is Chair Davis. May I ask a question?
Please.
Dr. Stegall, I appreciate the recommendation you just read, and I think it'd be helpful to us all if, of course, to have it in written form to reflect on this evening. And I recognize that our specific responsibilities are K-12, and that K-3 forms the foundation of reading throughout all grades. So I think this is a strong and effective definition to guide our work going forward. But I also reflect on the fact that so much of our students' success happens before they ever get to us. In fact, so much happens even pre-birth, but particularly from the time they're born to the first day they walk in our kindergarten class. And so I wonder if, given our sort of position in education of our children, if we couldn't influence some of those that are beyond our control, but which we depend on to prepare our children, by considering this to be a birth to 3 definition, and therefore gain perhaps even greater preparation for our students in reading in those first few years that we all know are all too critical. So, Mr. Buxton, I just offer that as a question maybe to our staff for reflection on how we could further leverage the strength of this definition.
Thank you, Mr. Chairman. Appreciate the spirit of the question, and would ask Dr. Stegall and any of the staff to respond.
Thank you, Mr. Chairman and Mr. Buxton. Yeah, as I shared before, we do understand that, especially birth through age 3, pre-K, their reading is very different than you would see in kindergarten and beyond, but it's no less important. And as half the pre-Ks in North Carolina come under the department's oversight. We also work with our external partners who oversee birth through pre-K, at a much higher level than we do in larger groups of students. But we do know those are all important, that we align the arrows, that we're all focusing on the same concepts and understanding. So I do think that, although again, it's hard to encompass a birth through age 3 in particular definition, which focuses, as I mentioned before, much more on receptive and expressive language, and is much more through text interaction and concepts of print. Those are all pre-reading skills, and they're very vital. It's part of the reason we originally had toyed with and thought and brought to you some examples of what a pre-K definition might look like. But I do believe that this definition could be a birth through grade 3 definition, with us giving specific guidance to our partners in the pre-K and child care centers, the guidance that will help support what that would look like in those settings for students who aren't quite ready for print manipulation and understanding, but are using those pre-reading skills and who are certainly focused on the expressive language and receptive language. We certainly can give guidance for that. So that would make, we could certainly endorse and feel comfortable this being a birth through 3rd grade definition.
Thank you, Dr. Segal, and appreciate the spirit of alignment that you and the chairman are talking through here. Given this conversation, board members, I would recommend, and the updated definition is in the chat. We can also make sure with Dr. Townsend-Smith's agreement that we can get it in the materials for tomorrow, that we, for action tomorrow, we will consider, and I'll recommend approval of the amended definition as it appears in the chat and as Dr. Stegall read, and that we amend it to be a birth through 3rd grade reading definition. We can have additional conversation about that tomorrow if needed, but that will be the way we'll plan to move forward as of now. Let me move to SLA 3. And that is our reappointment of and replacement of compliance commission members. Board members may remember we have a compliance commission which advises us on accountability issues. That's a over 25 or about 25-year-old commission. You'll see in your materials nearly all of the replacement needs addressed with a new appointment, a suggested new appointment. This is for discussion today. And then the members who would be reappointed, that space is not filled in because they wouldn't be a new appointment. They would be reappointed. So you can see all but 2. When this comes back to us in August, we'll have this fully filled out and ready for action. I will ask Dr. Howard to make any comments if board members have questions, but given the time, I'll just wait to see first if we have questions. Hearing none, I would just commend this list to you. Look in your region, ask any questions of the department or of me about individual proposed members. Our last item, SLA 4, is a consent item. You've seen the item, unless we need to have Dr. Fair answer questions, I would just say, just to make sure you're clear, this is a request to expand the list of courses that will be part of the adoption process. This does not change action we took, I think it was a few meetings ago now, to extend this process given the dynamics and the realities of the COVID-19 circumstances we're in. So this doesn't change that extension of time for this process, but it does bring new courses into the process. I'll pause for a moment to see if there are any questions for Dr. Fair to respond to. If not, this item's on consent, the consent agenda for a vote tomorrow. Hearing none, Mr. Chairman, that's our agenda.
Thank you, Mr. Buxton. That concludes today's updates and committee work. We will have 2 more committee meetings during tomorrow's board meeting, and I want to thank my colleagues, advisors, EPI staff, and others who contributed to today's meeting. We do have a few items for closed session, so I'll ask for a motion to go into closed session, and note for the audience and online listeners that following closed session, the July 8th, 2020 meeting will adjourn immediately. Vice Chair Duncan.
I move that we go into closed session to consult with an attorney in order to preserve the attorney-client privilege between the attorney and the public body, and to consider with an attorney's assistance and advice and give instructions concerning a potential administrative procedure or judicial action, and to consider personnel matters including the qualifications, competence, performance, or condition of appointment of a public officer or employee or prospective public officer or employee.
Motion by Vice Chair Duncan. Is there a second?
Second, JB.
Second by Mr. Buxton. Dr. Townsend Smith, will you call the roll?
Yes, sir. Mr. Buxton,
Yes.
Dr. Oxendine,
Yes.
Ms. Camnett,
Yes.
Mr. Keenan,
Yes.
Mr. Hall,
Yes.
Dr. Tipton Rogers, Dr. Tipton Rogers,
Coordinate with them close so that
Ms. White,
Yes.
Mr. Testine, Vice Chair Duncan,
Yes.
Chair Davis.
Yes.
It's unanimous.
Motion carries. Thank you. We will move into closed session. Let's take a 10-minute break and be back at like 3:47. Reconvene in 10 minutes.